the reasons we wanted to see you was because your blood pressure was slightly up.
That's right.
Yes.
If a patient goes to see their clinician, their doctor, their nurse or what have you, there are actually two experts in the room. There's the doctor, who will know what the treatment options are, what the risks and benefits of those might be, how effective they are, and which is clearly essential. But there's a patient who understands what's important to them, what they're trying to achieve in terms of their healthcare, what things matter to them.
My feeling is that you really have some choices, John, at this stage.
Yep.
Shared decision making is where you engage patients with their clinicians in coming to a joint decision where there are realistic alternatives in terms of treatment.
As far as I'm concerned, I think it's totally different to anything that's happened to me before. With doctors that I've been in contact with, and they've invariably just said, well, there's some tablets to take and that's the end of it. And you weren't involved in any respect. With this, it was something totally different. It's better because you're not a number or a sheet, you know, you're an individual. That's right.
What we've really looked at very carefully is what are the facilitators, what are the barriers, and how can we support clinical teams, clinicians and organisations to do this better.
We've got three options in terms of lowering your cholesterol.
If you talk to clinicians, most of them would say we already do this. There's a general consensus that we want to engage patients in decisions.
Clinicians have been doing shared decision making since we've had clinicians and patients, but there's good evidence that they weren't doing it as well on average as they could. We've worked around helping practitioners think about when is it appropriate to offer someone some choices, and then to start to develop some of the support materials that would help them do that in a more structured way, or give them more effective and clearly laid out information about those choices.
It's supporting clinicians in better development of their skills, because it's quite challenging sometimes to have that new type of discussion with patients.
The area that I've been involved with is women who have had a caesarean section in a previous birth and have to make the choice whether to have a vaginal birth after caesarean or whether to opt for an elective caesarean section. We send them out a package of information, and that includes an information leaflet, and it includes an Ottawa decision guide which we've adapted for use with this particular decision. It also includes narratives from women who have been faced with that choice and who have had either a caesarean or a vaginal birth, and they've spoken about how they felt about the process.
Clinicians tend to think that this takes more time. The evidence suggests that it doesn't.
It was about communicating to clinical colleagues that actually shared decision making is something that can fit still quite easily into this care pathway. The majority of women that we see have read the information leaflet and they come prepared to have this discussion, so it has been really positive.
Yeah, well, people who have taken part in choosing a treatment, quite understandably, are more likely to be happy with the outcome of that treatment after it's taken place.
I was diagnosed with an enlarged prostate, and I was told that would gradually get worse and that there are some treatment options for that. I got a lot of very helpful information, some of which I was able to take away. This included a booklet that also had a DVD.
The first option is just to continue to see how things go. You know, we've ruled out any serious disease. It does very much improve the relationship between the doctor and the patient in that consultation. Each person has a lot to bring to the discussion.
My preference would be to achieve that without taking medications, frankly.
Okay.
I really felt my opinions mattered, that I could ask any kind of question that I wanted to. I felt I was treated with respect. I felt I was listened to.
The evidence is growing all the time that this is a benefit to patients. Patients who are engaged in decisions about their own treatment are more knowledgeable, they understand the risks and benefits better, they're less anxious about the decisions they make, they're more likely to make decisions that are consistent with their values. There's also clear evidence that patients who are involved in decisions about their treatments are more likely to continue to take those treatments. So that we've learnt a lot about the various things that work and some of the things that don't work. And from that, we're creating a range of resources that other organisations who want to start this journey can draw upon, and those will be made available through a Health Foundation based website, so that when they come to do this, they're not starting with a blank sheet of paper. They can learn from some of the things that we've learned.